Welcome to another segment of Accomplished Minds. And today, many of you may be surprised to know that childbirth is the leading cause of death among women of childbearing age in the developing world, where access to basic maternal and care for newborns is limited or non-existent. Today, I'm speaking with Allyson Cote, the Vice President of Maternova, a wholly owned, woman-run startup company that has built the first global marketplace innovation, incubator, and collaboration platform dedicated to improving maternal and newborn health. Allyson, it's a wonderful pleasure having you here on Accomplished Minds. Welcome.
Well, thank you very much, Lorena. It's a pleasure to be asked.
As a leading cause of death, why is this not a front burner health issue?
Well, it actually it has gained a significant amount of traction in the past few years, and it is on track and recognized as one of the top Millennium Development Goals. So it's not certainly for a lack of awareness. I think what is a primary issue is really getting devices, getting life-saving technologies into the field. So that they can be utilized, and really prioritizing women and newborns as, a top medical and healthcare concern in public global health.
I see that the Bill Gates and Melinda Gates Association tackled that issue as I wanted to eradicate by 2015. They have a goal.
They are very big advocates, yes.
Okay, great. So tell us about Maternova. Explain how your organization works to challenge this great problem.
We are an overnight success that took 4 years to get that way. And I am a kind of a late entry co-founder. The company was originally started by Meg Worth, who is very highly accomplished academically. She holds an MPA from Princeton. And did extensive amounts of research in the field. And really kind of the catalyst behind Maternova is an interesting story. She was working on a project for the United Nations, and she was actually staying and living in a maternity hospital in Indonesia. And one of the women on the team, on the research team, was herself an obstetrician and gynecologist who unfortunately went into labor and delivery and subsequently passed away because there was a lack of any type of medical devices or anything that they could really do to treat an obstructed labor. So it is something where Meg felt very passionately about it. So the original inception for Maternova happened back in 2009. And it was built primarily as an innovation index. And when you look at our website, you'll see that we've got about 225 devices that are being tracked. And these are in various stages of development. Everything from products that have just been commercialized. There are some that have been in the field for a while, just really aren't all that well known yet. And then there are some that are in the very early stages of development. So these are your prototypes. These are kind of your rough sketches. And what happened is Meg realized that there were people who were coming to the website who really loved the innovations, and they actually wanted to buy them. So for the smaller entrepreneurs who have these incredible products, it became a challenge, and they didn't really know how to get those products into the market. So Meg came along and definitely with a tremendous amount of foresight, decided to create the online marketplace. So that is how it all started. And it originally started with one obstetric kit. And it's a combination pack of some really cool tools. It's affordable, highly effective. It's one of our highest rated products. But we also quickly realized that people were looking for lots of different products. So we've expanded our marketplace to about 25 products, very proud to say. And we have goals to actually move that upwards of 100 by the end of this year.
So then who are your customers, your main customers?
Oh, our customers are everywhere. They run the gamut. We have everything from independent clinicians to hospitals and clinics to NGOs. We also bid on government tenders. So there really isn't one one size fits all for our customers. Our goal is to ultimately, I'll knock on wood for this, to work with, obviously the larger NGOs and be able to do countrywide government tenders. But we also never want to alienate or forget the independent clinicians and the people who really help put us on the map.
So you probably, how many countries are you serving so far?
Wow. Well, it's interesting. We have a tremendous amount of global traction, and we are visited by people from over 170 countries.
Wow.
We have successfully sold into 28 at this point.
Oh.
So we're getting these devices into where they're needed most. And we recently did a shipment not that long ago of 100 of our obstetric kits that went into Timor-Leste, into East Timor, which is just about as far away from us as you can possibly get when you look.
So what about, I'm amazed. So these new technologies and solution, how is, all right, it's kind of like a bridge. She has a platform so where people could come to a common marketplace.
Right.
And so what about training? Because when you ship it out there, how would people know how to use the technology?
You know what? That's an incredibly good question. And there's a few parts to the answer. The first part is that we typically will provide training materials that can go with the product. One of the products that we have right now is called the non-pneumatic anti-shock garment. And that is something, it looks kind of like a scuba suit. It's a little crazy looking, but it is a very effective way to treat a postpartum hemorrhage. We have a DVD that is a training DVD that goes along with that. We also have a lot of little jump drives and flash drives that have training material on it that we can send out with all of our products. Then we also have printed materials. But one of the things, and this is kind of where I came into play with Meg, is we've also built into the platform our collaboration platform. And that is the best way I can describe it to you would be, think of kind of a Facebook meets a blog, meets a clinical trial. It is a private network where people can join together. It can be a global interaction. It can be around a specific technology. It can be client specific. But what we do is we want people to share their best training practices. We want them to all be up to date on the latest information. And most importantly, we want to make sure that what they're doing safely and effectively. So it's one way for us to do, quality control, but also provide that extra level of training and promote the connectivity among coworkers, which we found to be really one of the biggest problems. People simply weren't able to connect with each other. And information, we'd find a great little kernel of knowledge in one country, and we'd speak to people, in another country, they'd never heard of it. So we're looking to really eliminate that barrier and make sure that everybody knows the quickest, the easiest, and the most cost-effective way to save lives.
Wow, that's fantastic. Yeah, and also I was figuring about the language barrier, because I'm sure that they're not only speaking English.
You're right, they don't. But all of our products are actually available in Spanish and French. The website itself can be translated. And yeah, it's a work in progress. Our translation capabilities aren't 100% where we would like them to be, but they're about halfway there. And we're finding that you'd be surprised, it turned out not to be as big of a barrier as we originally thought. And I would agree with you that at first, when I first looked at it, it just seemed kind of an insurmountable task, but it's amazing how quickly and how helpful people are to one another. And with some basic translation tools, it really can take care of itself.
It's amazing what technology can do, to have these people all interconnected now and seeing and learning from, this is what happened in my area, this is what I do, and you can also apply the same thing to your side of the tongue.
And, we're finding that, the expansion of mobile health technology, smartphones, cell phones, even SMS text messaging, into the field is skyrocketing. Just about everybody has access to a cell phone. A lot of people, at this point, I think about 15% of Africa is online on a regular basis. So that's a huge portion that's not. Yes. But just about everybody's got a cell phone. So what we can do is we can connect with people via text messages, and we can keep them in the loop, check in with them, see how they're doing, make sure that, you know, the products are working for them, that they're using them correctly. So even though they may be, you know, what would largely be considered in a different world, they're not really, because we can still connect.
Yeah. And they're not out there feeling like, you know, have a product and there's no backup or no support.
It's very frustrating, and it has caused a huge amount of attrition out of the field. And that's something that we're really looking to turn the tide on. I'm very passionate about creating connectivity, peer support, creating a sense of camaraderie, and really using what would really be best described as a trusted social network to be able to increase efficacy of all the things that are going on out in the field with devices and practices. But we're also looking to save money for clients who are out in the field, because every time someone leaves, you have to retrain. Then there's a learning curve. There's all of these things. So if we can do it right the first time, and we can keep people happy and make them feel as though what they're doing really does make a difference, because it does. They are incredibly important, selfless people out in the field saving lives. We want to be able to do that. And I really feel that it was kind of the missing piece. We need to humanize it and really tell the stories, make people aware of some amazing individuals all around the world and what they're doing on behalf of women and children everywhere. And that's something that we feel pretty strongly about.
I like that you say, you know, make people care. I realize that your organization was recently awarded the Palo Alto Life Plan 10,000 boost, and congratulations.
Thank you.
The CEO of Palo Alto Software, Sabrina Parsons, delightfully commented that the open quotes, the Maternova team is pouring their heart and soul into the enterprise, and it shows. Close quote. That's quite a comment to get. And it is even difficult for an organization to attain that comment. How do you get your team engaged, and how do you get them to care?
Oh, wow. Well, that's actually a great question. And I didn't know she said that. That's really, but, you know, I think the interesting thing about Maternova is we are a small team, and that is something that I think belies our public persona and our global health image. I think people think we are significantly larger than we actually are, but our whole team, believe it or not, you can count it on less than 2 hands.
Really? Wow.
So we do have a small group. There is myself and Meg. We are here full time, but we also have some people who are, they're not in the office, but are part of our team. Our program manager, Emily, our accountant and financial guru, Karen. We have our quality control director, Cinta, and everybody is, not everyone's working together, but we are still very much together because we have to keep moving the company forward.
Yeah.
I think it really comes down to what sets us apart, I think, really is probably just our level of commitment. We are every day moved by the stories we read, the people we talk to. And it's pretty hard not to be affected and not to be motivated to want to change what's going on in the world, and to try to help the people who really can't help themselves. And I think we've put ourselves kind of in an interesting position where we're able to kind of reach across different boundaries and get in front of different audiences, and hopefully provide a bridge for a lot of people. So it comes right down to passion. It's very hard to run a startup company if you don't have it. And there is no shortage of it here. I can tell you that safely.
That is wonderful, and that is so true, because if you're not interested, if you don't feel like getting up in the morning, to go and pursue whatever is on your desk. It makes no sense.
That's true. That's true.
So what I always wonder about, if you were given an advisor aid to, for example, a government of one of those developing countries to reduce this problem, what critical factors would you tell or would you advise the government to do?
Oh, there's a couple. If we were talking to the government, the first thing would be that they really need to take a very long and hard look at the presence of their frontline healthcare workers and their trained birth attendants. And that is because in many countries over in Africa, you can have a doctor to patient ratio of 20,000 patients or 20,000 citizens for every one physician. Some countries have less than 5 physicians or less than 5 obstetricians in the entire country. So my first thought for them is that it is a very worthwhile investment to increase significantly the number of frontline healthcare workers, trained birth attendants, and midwives that they have in the field. The second piece would be that it would also really be beneficial for there to be a common set of medical innovations that are almost kind of a basics kit for any government who are looking to institute such a program that they have for their healthcare workers. And we find with all of the groups that we talk to that not everybody is even aware of certain devices' existence, that they have no idea that certain products exist. So I think, just something that is a universal, that would be the best way to describe it, a universal kit, a universal package of, say, 10 or 12 basic tools that no frontline health worker should ever be without, and to keep them in stock.
So it's like a policy.
Exactly.
Setting up, okay.
Exactly.
And how would you say also to education, if the government want to probably invest in their human capital of going into the medical side of things, would that also help?
Absolutely. Yes. It's something the return on investment for them is substantial and significant. And let me give you an example. One of our devices that I know we talked about is our NASG, and that is a very simple, non-invasive intervention for postpartum hemorrhage. It's something that can be done with, a minimal amount of training. Of course, there's always conditions around that. It's something where there has to be the guarantee that the woman will be taken to the hospital. But what it does, it basically buys a woman an additional 24 hours to be transported. Now, when we look at that, this device typically costs about $100, and you can use it 40 times. That's about $2.50.
Okay.
For a traditional hospital inpatient treatment for a postpartum hemorrhage that did not have the benefit of that particular intervention or other low-cost intervention that can be done on site, they are spending in between $13 to $45 for every $1 that the NASG costs. So it is a staggering return on investment for them to be able to bring in these really low-cost, very effective devices, properly train people how to use them, and be able to cut down on the charges and the, just skyrocketing costs that people in the public and the private sectors are facing now. And obviously, it can only benefit their citizens because many of them, as we know, when it comes time to provide for their own healthcare costs, they simply don't have the money.
No.
So the more we can do to help them so that they aren't turned away from care, as we know many of them are, it really is, it's the right thing to do. It's the easiest thing to do. And it's the most cost-effective thing. So it's a win-win-win across the board.
So, Allyson, what would you tell people, especially people coming from the developing countries? And I always ask this question of all my guests here on Accomplished Minds. What would you tell people who have an innovative idea, who want to make a huge impact to people's lives, and they just don't know how to start, or they even probably afraid of getting started? What advice would you give them?
There's so many good ideas out there. That's I want to make sure I answer this one to the best I possibly can. There are some amazing ideas coming all over the world that people are developing products and systems and technologies. It's just every day we never cease to be amazed. But the best thing I would suggest is, to really do your homework online. Look for what would be considered, similar items in the market. Definitely look to see if there has been a patent submitted for any of that. Mm-hmm. And then do your market research. Look to see, who your clients are potentially going to be. Can you even have this product manufactured if it's an actual product and not intellectual property? Mm-hmm. And then you also want to start looking at a business plan. And it's funny that you mentioned the live plan win, but having a good business plan that really clearly spells out your vision and your expectations and your strategy is the best and simplest way to draw the attention of people who can fund you mm-hmm. and people who want to invest in you. So that really is your most basic kit, to me is to do your homework. Find out if it's an original idea or not. Find out how easy it's going to be to make and how much it's going to cost, and then get it into a business plan. But don't ever be discouraged by things that you may see online or feedback that you may get from people, because you will undoubtedly be told no several times. And you just can't give up. You've just got to keep going, because if you really believe in what you're doing, make sure you're super passionate about it. Make sure that it's something that you are willing to sacrifice a great deal for. That's usually how the best ideas are born. And just know that it typically, if you think it's going to take a lot of work, it's going to take twice as much.
I like how you said that, twice as much.
Twice as much. You may think it's going to take a lot, but it's going to take so much more.
Yeah, it's not easy sailing.
Not easy.
Okay, so how does success feel to you?
I don't feel as though we've been that successful yet, which is funny because
Really?
everyone else has. I think that's, you've asked some great, really great questions. I think, Maternova, we've had a lot of success in the public eye.
Yeah.
Just in the past 5 months or so, Meg and I have won, I think it's 6 significant contests or distinctions, which has been great. And we are incredibly blessed to be able to do what we do. But as far as success goes, I don't know if we're going to consider ourselves really successful until we've put a sizable dent in the problem, in our objective, which is saving moms and babies. Once we know that we have really changed the game, and been able to say, the work that we did contributed towards saving X amount of lives, or this mom and baby is alive today because of what we were able to help their country do for them, mm-hmm. then I think we'd be able to say that. And we've seen it. We have seen it, and it's incredibly inspiring. We get pictures a lot. People send them to us from the groups that we work with. But I don't know if we're ever really going to be happy. We're really thankful, and we love what we do. But I don't think we'll ever get comfortable with thinking, okay, we're successful, we can call it a wrap now, because there's always more.
That is so true. I like how you say that. There's always more. There's always better.
Always more. It's and I think to be successful in a startup environment, you can never get tired. You can never be satisfied. And it is completely safe to say that none of us on this team ever will be, no matter what happens. We'll be very thankful and very grateful and very, enthusiastic about pushing forward, but satisfied probably not, because, I always think we can do better. So
that is so true. So true. So what are the future plans for Maternova going forward?
Future plans. Well, we're in the process of building out the collaboration platform that is actually going to take on an entirely new life in the next few months, where we are adding in some additional features and really changing the game for that, as far as adding in new ways for people to connect. We're going to be adding in some ancillary products for people, so that it will be a little bit different approach than strictly the clinical things that we're focusing on now. We're also going to be we're focusing on updating and improving our SMS and our texting and our mobile capabilities. But I think, something that I'm really excited about with the work that we do, we get to see all these great products, but every time we see one, it's funny how you can always find things that can be improved on them, or you find a gap altogether, something that just simply doesn't exist yet, but it should. So what we're really looking to do, and I'm super excited about it, is looking to start producing proprietary products. And we have a lot of ideas, and a lot of actually really good ones. We've given them a lot of thought. We're looking to create something entirely different. And I think, there are a couple that we will be rolling out that we're really going to, put our stamp on as being, this is our signature proprietary product. And I'm excited. I can't wait to get them out in the market.
That's really amazing. And I also noticed something called the mapping tool when I was on your site. What's that about?
Yeah, the mapping tool is something, it's proprietary to us. It is our smart map technology. And what it does, people can go in and you can really visualize data in a completely different way. So it can help our clients and the groups that we work with track the progress at their clinics. It can show how a product is saturating a particular market. It can show clinical test results and pilot programs that are happening all over the world. And it can actually be customized and expanded, so it can hold upwards of 30 fields. Each one is made into a little pinpoint, like a push pinpoint. They can be color-coded, and it's all layered over our own database. So it's got some reporting capabilities that are actually pretty robust. And it's a nice way for people to present things when they're looking just to get a quick snapshot of how their program is running, what devices, what drugs, what protocols have been implemented and where, and how they're working out. So it's just a nice way to see things differently.
And you also could get tracking, and you could also get...
You bet. Yeah. It's one of the things that I also think is definitely... a need in the field, and we found this out from our own exporting and importing that we've been doing. But finding reliable transport to get supplies in country is can be a challenge for a lot of people. And I think we would love to be able to collect as much information from our clients and the people on our website who belong to our network as possible, and then really create a visualized plan for people to be able to find reliable in-country transport, to be able to bypass some of the corruption, unfortunately, some of the additional fees, and really just make sure that the supplies are going to get there in the first place. Because we all hear horror stories about sometimes things just don't make it or they get lost. So anytime we find a great resource and a great in-country courier or provider, we want to make a note of it and, make sure that everybody's aware of it, because it saves time and it saves money.
Yeah.
Yeah.
Well, Allyson, thank you so much for taking time out for doing this interview. It was a pleasure talking about women's health and the babies, and it's wonderful that we are tackling this issue.
Well, thank you very much, Lorena. I appreciate you having asked me. Like I said, I know I relief pitched for Meg. Hopefully I did it justice, and we're so flattered that we were able to to be part of this, and we look forward, hopefully, to following up and speaking with you again.
Yes. If you'd like to see more, subscribe to accomplishedminds.com.